most helpful experience was like the entirety of the experience working one-on-one with a nurse preceptor. I feel like it's really hard in like other clinicals when you have a preceptor and then like you get through the day and you're like, oh, I finally, established a relationship with them. They feel confident with me doing skills, and then you kind of leave and have to kind of, redo it over again. So I think that was the most impactful to my learning, was being able to learn and grow with my preceptor. I would totally recommend it. I know that I think when we started off, there was maybe like 8 or so students that were doing it. And every one of them had like such great experiences. It's just so different from other clinicals. And I feel like it really makes nursing students feel more confident in themselves. I feel like the longevity, the ability to kind of have those long-term relationships with the care team and with the patients was really something different than I experienced with any other clinical that I really, really loved about it. The preceptor I had was very kind to me and the other nursing student that was with me in that program. She was also someone that I asked to have a letter of recommendation when I got my first job. So I think that was really helpful because it's always hard to find those. And so someone who also was like a mentor to me as a nurse. Compensation definitely was really helpful. I was working as, a nurse tech during that time, and I did, still try to work, but the pay was better than I was making as a nurse tech when I was doing the long-term care externship, so it was definitely helpful. The scholarship was also very helpful. When I was taking it, it was my spring quarter of before I graduated, so helping with like prepping for the boards was really nice to have, or to pay off my loans. Some of the skills that we practiced were like central line removals, IV removals, IV insertions, blood glucose test, like bladder scanning or PVCs, medication administration, like through multiple routes. Lots of great experiences connecting with the patients. It was great. We would come once a week there. They always remembered us when we left. It was very emotional to say goodbye to everybody, and everybody was, really sad to see us go. So like definitely built so many connections. They heard so many different like life stories from the patient. One of the patients had really chronic diabetic ulcers. Often we would provide wound care, and she was always really like helpful and like really encouraged us to help with the wound care. And she would even like kind of allow us her kind of techniques that she's seen other nurses do with her wound care. I feel like the most rewarding part about working in long-term care, I think, was definitely helping an underserved population. I think that was something that was really impactful to me, and kind of learning more about the experiences in long-term care. The externship definitely did impact and help my overall career path after graduation. It really helped me feel like confident in my skills and my ability to be an independent nurse. Of course, with nursing, you get into a specialty, you have to learn more of those, skills that are specific for that specialty. But I think that really helped kind of get my core established so that I could be able to kind of change and learn different skills and still feel like, okay, I have my core skills and essentials down. I truly think that like even if you're not interested in the setting of long-term care, right after you come out of nursing school, I know that a lot of times a lot of professors and individuals really, want you to go into bedside first. Having that independence as a nursing student was really great, which often I found that it was hard to kind of get into during the other clinicals. So I think that was a really impactful part of feeling more confident. Like after I'm done nursing school, like I'm going to be on my own doing all of this. Like how am I going to be able to do this? So I think that was like the most rewarding part of being like, I can do this. I made it through these like 2 quarters and I can do it.